The Change Foundation partnered with the Innovation Cell on this project to look at social media and quality improvement, because we had spent a number of years in the field with healthcare providers trying to redesign care for patients. And it was very much an on-site, face-to-face interaction, meaning that patients and their families had to be physically in the building and involved with providers. And it struck us that social media techniques and methodologies might be a way of getting more people involved in thinking about their care across a broad spectrum of patients. So the project was an opportunity for us to try to explore whether that was possible and whether healthcare organizations had given it any thought and whether there were any best practices around the world. They are known for their social media savvy, both technically and also sort of policy and program delivery. And what really caught my eye personally was work that the Innovation Cell had done for the public health sector during H1N1. So they were looking at what people were saying, what patients, family members, parents were saying largely online about why they were afraid to go and get the vaccine. And so we had this interesting situation in which public health was trying to get people vaccinated. The numbers weren't really, really high, and they didn't quite understand why that was the case. So when Innovation Cell looked online and found what people's concerns were largely related to things like fear that there was lead in the vaccine, they were able to then get public health to redesign their communications campaign and get people to bring their children in. So it struck me as a fantastic way of understanding patients, families, kids' fears, and a way in which you could redesign your, in this case it was communications, but you could also redesign your care based on information you'd have no other way of finding out. So we saw that work, thought it was incredibly innovative, thus their name, the Innovation Cell, and we're very keen to partner with them. We've had a really interesting time with this project, and we've probably got about 3 big learnings from this project. And it's fair to say that it was very much an exploration. We started on this journey having absolutely no idea what we were going to find. So the first aha for us was that healthcare organizations in Canada are not taking advantage of social media for quality improvement purposes. We did find a number of organizations, in fact hundreds of them, larger provider organizations, that were using social media for communication purposes, for fundraising purposes, for branding in the marketplace, so to speak, but not for quality improvement. So we realized that we were going to have to start pretty much from ground zero in terms of working with provider organizations to get them intrigued. The second learning for us was that there are organizations in other parts of the world that are a little bit further along than Canada. Not a lot, but a little bit further along. And so there are places where we can go to learn how organizations can take this methodology and bring information back into their quality improvement processes in their own buildings. And then the third piece for us was to really find a couple of field partners, which we did do with CAMH and with Providence Healthcare, and look at working with their quality improvement teams sort of on a daily basis, hand-holding a little bit, to try to figure out if an organization in Canada was interested in going down this road, how on earth would they actually do it internally? How would they embed information that they got through social media methodologies into redesigning their care? So those are really the 3 things that kind of excited us when we started this journey. Lots of organizations who may have some interest in using social media do rightly raise issues around what about privacy issues, what about personal health information issues, what about the reputation of the organization. And in our project we actually have a number of case studies that address those issues head on, so there will be good resource material and advice to help people think through what to do about that. Having said that, you have to take a step back, I think, and view this as a little bit different than other traditional healthcare kind of concerns about privacy. So this is taking information that is publicly available, that people have willingly provided about themselves, and looking at it, analyzing it, and then thinking about what it might do to change care in your organization. So it's not like you're looking at somebody's personal health record without their consent, which is, I think, where healthcare providers tend to go. So it's very, very different in terms of the way in which information is provided. People are self-disclosing. Secondly, the reputation concern. I think healthcare providers rightly are worried that it becomes a complaint form. And that's all it is, and that you're not responding. That's not the role of these kinds of social media techniques. And it's all out there, and it's, what can you do about it as an organization? And there is some validity to that, because it does become a little bit of a complaint form sometimes. But generally speaking, people then want to get to solutions. And that's the part, I think, where the organization can play a facilitative role. If you have a forum where every single person on that forum is saying, this is what happened to me and I didn't like it, then there's some, I would hope, interest in the organization in trying to fix that. So it's really just a way of getting more information about people's experience when they are in your organization. And if you're not interested in fixing it, then you shouldn't be going down this road. So I think there has to be an upfront commitment to changing things on the basis of the information that gets received. The province has passed legislation, Excellent Care for All, which does require hospitals and in the future other healthcare providers as well to have a very focused patient-centered process in their own organization. And their first step in that road is that they must have patient surveys, patient satisfaction surveys underway. That will provide data that will go to a quality committee of the hospital board, and the hospital will have to produce an annual quality report. So this is a way of providing data for that process in a different way than hospitals have done before. Hospitals, certainly in Ontario, have got a history of having patient satisfaction surveys, often written, sometimes online, sometimes by phone, but they tend to be fairly expensive and labor intensive. So this is another way for the hospitals to get a much more broad set of data quickly in real time and an ongoing basis that they can then roll into the requirements that they're now having to fulfill under the legislation. So I think it's a fantastic way of doing what you have to do legally, but being quite innovative and outward looking at the same time. When we work with the Innovation Cell to release all of this material, we sort of have a couple of different groups in mind that we hope we'll be able to both use the material but then have further discussion with about future work. The first would be folks who are not in this game at the moment. They're not even using any social media for their own communication purposes. So there's a set of material, sort of like a social media 101, that will help them kind of think through, okay, what are the steps we have to take to just get started? Then there's sort of a mid-level group who are probably using social media for communications and fundraising purposes, but haven't taken the next step for the QI bit. So there's resources for them in terms of how they might make that step. And then sort of the third group, which I think will be a fairly small group, who are probably thinking about how to bring the information into their QI process, but don't quite know how to do that in a very sophisticated way. So hopefully we'll have a series of partnerships with organizations in each of those categories where we can further monitor progress and facilitate improvement by using these tools. When we think forward and the impact that social media might have on healthcare, I think it could be quite phenomenal. It's not going to go away. I mean, we can hide under the table, but it's not going to go away. And when you look at other sectors, you see the vast impact it's having with customers and clients. So it's very hard to imagine that healthcare would not be touched by this in some future life. So those organizations that are, I think, out in front and are thinking through what they'd like to set up and how they'd like to facilitate it, rather than having something go viral and finding themselves in the middle of a mess, I think are going to be well positioned for future. Ironically, when we were starting this project, the fellow who had his guitar broken by one of the airlines had just, that video had just gone viral. And watching the airlines, try to respond to that and then think through how would a hospital or a healthcare provider respond in a similar situation. So we're not ready, but I think this is a step to help people get ready. And those who've got good leadership, I think, will grab it.